After 70, most people believe that the more medical checkups they get, the safer they'll be. Every year, millions of seniors line up for tests convinced that routine screenings are protecting their health. But what if the truth is the exact opposite? What if some of those very tests, the ones your doctor orders, almost automatically could push you closer to unnecessary surgery, dangerous side effects, or even cancer? This isn't a scare tactic. It's what new research is proving. Studies now show that nearly 37% of medical tests given to seniors lead to overtreatment complications or lifelong side effects. And here's the part that's even more shocking: almost 99% of adults over 70 have no idea they're being overtested. They think they're doing the right thing, when in reality, these checkups can quietly rob them of quality of life instead of preserving it. Even worse, one of the most common preventive scans on this list has been linked to as much as 5% of all cancer cases in the United States. To put that into perspective, that's the same cancer risk caused by drinking alcohol every single day. You won't see this statistic on a billboard, and you won't hear it casually mentioned at your doctor's office, but the evidence is buried in peer-reviewed science. That's why this video takes a closer look at the 5 health checkups seniors over 70 should avoid. Backed by real studies and clinical cases, you'll discover how certain routine tests can quietly damage your health and what safer alternatives you should be asking about instead. It sounds harmless. A quick scan, no pain, no needles, and you walk out thinking you've learned something useful about your health. That's the promise of the bone density test, also known as a DEXA scan. For decades, it's been sold to seniors as the gold standard for spotting osteoporosis and predicting future fractures. But here's the uncomfortable truth: after age 70, this test often creates more fear than benefit. The reason is simple: bone loss is a natural, universal part of aging. Just as wrinkles form on your skin and your hair turns gray, your bones will gradually lose density. That doesn't mean they're weak, brittle, or in danger of breaking at any moment. It simply means you're getting older. Yet the DEXA scan rarely tells you that. Instead, it slaps a label on you: osteopenia or osteoporosis, words that trigger fear. And fear leads directly to medication, often drugs called bisphosphonates. On paper, bisphosphonates are meant to strengthen bones. In reality, they come with a laundry list of frightening side effects. Doctors rarely mention that these medications have been linked to jaw necrosis, a rare but devastating condition where the jawbone literally starts to die, severe esophageal irritation, and in some cases, bones that become more brittle over time, breaking in unusual ways. Imagine taking a pill to protect your bones only to discover it's putting them at greater risk. And here's the kicker: the benefit is tiny. A study in the Journal of the American Geriatric Society tracked over 1,200 women over 70 for 5 years. The reduction in fracture risk from bisphosphonates, just 0.3%. That's not a typo, less than 1/3 of 1%. In exchange for that tiny margin, thousands of women endured chronic reflux, stomach inflammation, and bone pain. The numbers don't lie in this age group. The cure often causes more damage than the disease. Take the story of Rose, a 76-year-old retired piano teacher. She had never fallen, had no pain, and walked every day for exercise. At her annual checkup, her doctor suggested a bone density scan just to be safe. The results showed osteopenia, a mild reduction in bone density that isn't even considered full osteoporosis. But the word alone frightened her. Her doctor prescribed alendronate, a common bisphosphonate. Within 3 months, Rose was suffering severe acid reflux and sharp pain in her jaw. Playing piano, her lifelong passion, became unbearable. Instead of protecting her, the treatment took away her joy. When she came to a second doctor for help, they immediately stopped the medication and replaced it with a much safer natural plan: vitamin D supplementation, weight-bearing exercises like resistance bands and light weights, and a calcium-rich diet, including sardines, leafy greens, and dairy. The result: 1 year later, Rose was back on stage performing at local recitals with stronger legs, better balance, and 0 fractures. Her confidence and her music returned, all without risky drugs. This isn't just anecdotal. Lifestyle approaches to bone health are backed by hard data. A 2022 study in osteoporosis international found that seniors over 70 who focused on strength training, balance exercises, and correcting vitamin D deficiency reduced their fracture risk by over 20%. Compare that to 0.3% from bisphosphonates. The difference is staggering. So, why does this matter? Because tests like the DEXA scan can set off a domino effect. First comes the label, then the prescription, then the side effects, then the follow-up appointments. All while the underlying reality that bone density loss is natural and doesn't always equal danger is ignored. For many older adults, this test does not improve quality of life. It diminishes it. That doesn't mean every senior should ignore their bone health. Far from it. But it does mean that after 70 prevention should shift away from numbers on a scan and toward daily habits. Here's what experts recommend. Strength training. Lifting light weights or using resistance bands stimulates bones to stay strong. Balance exercises. Activities like Tai Chi yoga or even simple one-leg stands can dramatically reduce fall risk. Vitamin D. Whether from moderate sun exposure or supplements, it helps your body absorb calcium effectively. Calcium from food. Sardines, salmon, with bones, leafy greens, and dairy deliver calcium in a natural, safer form. Daily movement. Walking, gardening, climbing stairs, anything that keeps the body in motion supports bone integrity. The takeaway is this: after 70, a DEXA scan might look like a harmless piece of preventive care. But for many seniors, it's a doorway into unnecessary worry, harsh medications, and health complications. Instead of letting a machine define your risk, focus on the proven practical steps that build strength, balance, and resilience. Your bones and your quality of life will thank you. Forgetfulness is scary. Misplacing keys, blanking on a familiar name, losing your train of thought mid-sentence. After 70, these moments can feel like the first signs of something far worse. For many seniors, the immediate fear is dementia or Alzheimer's, and doctors, hoping to be thorough, often order a brain MRI. On the surface, it sounds reassuring, a high-tech scan that can see inside your brain and reveal what's going on. But here's the uncomfortable truth: for seniors with mild memory issues, an MRI is rarely helpful. In fact, it often does more harm than good. Why? Because in people over 70, MRIs almost always show age-related changes, slight shrinkage of brain tissue, tiny white matter spots, or other minor findings that are completely normal at this stage of life. They don't mean disease. They don't predict dementia. They simply reflect the natural process of aging. Yet, once these abnormalities are printed in black and white, they can unleash a storm of fear and unnecessary procedures. The data is striking. A 2021 review published in Neurology Today looked at more than 3,000 MRIs performed on adults aged 70 to 85 with mild memory complaints. The results: 86% of scans showed some form of brain abnormality. But only 3% of those findings were linked to a treatable condition. That means 97% of seniors left with worrying scan results that had no real medical significance. And the consequences don't stop there. Once something suspicious is seen, the pressure to do something takes over. Patients are often referred for additional tests, sometimes invasive ones like spinal taps or even exploratory brain biopsies. In extreme cases, surgery is performed even though the MRI didn't actually reveal anything requiring intervention. These procedures carry very real risks, from infection and bleeding to long-term cognitive side effects. Consider the story of George, a 74-year-old retired engineer. George was sharp, witty, and active, but lately he'd noticed he was misplacing his keys more often and occasionally forgetting names. His doctor, aiming to be cautious, ordered a brain MRI. The scan came back showing white matter changes completely typical for someone his age, but the report didn't make that clear. The effect on George was devastating. Convinced he was developing dementia, he withdrew from his life. He stopped driving, quit volunteering at church, and avoided social outings. His anxiety spiraled, and his memory actually seemed worse because he was constantly worried about it. When George was later reassessed with a simple paper-based cognitive screening test, his scores were perfectly normal. His memory lapses were no different from what any healthy senior experiences. The MRI findings hadn't revealed dementia, they had only triggered unnecessary fear. With reassurance, lifestyle adjustments, and brain-stimulating activities like puzzles and memory games, George stabilized within 3 months and felt like himself again. This is the hidden danger of MRIs for mild forgetfulness. They often create patients instead of helping them. A harmless spot on the scan can change how you see yourself, how your family treats you, and how your life unfolds. So, what's the smarter approach? Experts recommend starting with a cognitive screening test. These are simple paper-based exams that take 10-15 minutes, cost almost nothing, and reliably evaluate memory, attention, and problem solving. They can show whether your concerns are normal aging or something requiring further evaluation. If symptoms are mild and gradual, these screenings are often enough. Of course, there are times when a brain MRI makes sense if someone develops sudden neurological symptoms, such as seizures, dramatic personality changes, rapid decline, or new movement problems. In those cases, imaging may reveal a stroke tumor or another condition that does require urgent treatment. But for the vast majority of older adults with mild forgetfulness, an MRI is not just unnecessary, it's potentially harmful. The lesson is clear: don't let fear push you into a machine that might tell you something meaningless. Before scheduling a brain MRI, the reason lies in accuracy, or more accurately, inaccuracy. Studies show that in adults over 70, the rate of false positives, meaning the test suggests a problem when there isn't one, can be as high as 40%. Almost half of the time, the test is wrong. That false alarm can set off a dangerous chain reaction. Once the test suggests trouble, patients are often sent for follow-up procedures like angiograms, where a catheter is threaded into the heart's arteries, or even stent placement or bypass surgery. These are major interventions. And here's the shocking truth: for seniors without clear classic heart disease symptoms, these procedures often don't improve survival or quality of life. A landmark 2017 study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms and gained no measurable benefit. Their life expectancy didn't improve, their chest discomfort didn't resolve. What they did gain, however, was exposure to serious risks: bleeding from catheter insertion sites, kidney injury from the contrast dyes used in angiograms, prolonged hospital stays, and complications that ripple for weeks. Take the story of Raymond, a 75-year-old retired postman. He had stayed active by walking every day, but during one checkup, he casually mentioned that he sometimes felt more tired than usual when walking uphill. His doctor, erring on the side of caution, scheduled a stress test. The results came back unclear. That single word triggered a domino effect. Raymond was referred for a catheterization. Doctors found a mild narrowing in one artery and decided to place a stent. But that night, Raymond developed a reaction to the contrast dye used in the procedure. His kidneys faltered, and he ended up spending 6 days in the hospital. He went home weaker than before, needing follow-up care and medications he'd never taken previously. And the worst part, his fatigue hadn't been caused by his heart at all. It turned out he was simply a bit dehydrated and needed more rest between meals. The stress test had taken a minor complaint and turned it into a cascade of procedures that harmed rather than helped. So what's the smarter path forward if you're over 70 and not experiencing the classic symptoms of heart disease: chest pain during activity, shortness of breath when exerting yourself, or a sharp drop in energy during even light exercise? Then a stress test may not be the best first step. Instead, safer and simpler tools are available. A resting EKG, which records your heart's rhythm while you're sitting, still can detect dangerous irregularities without risk. A coronary calcium scan, which uses a very low dose of radiation to look for calcium buildup in the arteries, offers a more accurate picture of your true risk. Unlike a stress test, it doesn't create the same rate of false positives and doesn't push you into unnecessary procedures. The lesson is this: don't let mild fatigue or vague symptoms rush you onto a treadmill and into a high-stakes medical pipeline. Always ask your doctor, what will this test change about my care? If the result is positive, what's the next step? Is there a safer way to get the same information? For many seniors, the answer will be yes, there is a better, safer way. And by choosing it, you avoid the trap that caught Raymond: a well-meaning test that led to unnecessary surgery, kidney complications, and weeks of recovery, all for a problem that never existed. Sometimes, especially after 70, less really is more. A careful conversation and the right test can keep your heart safe without putting the rest of your health at risk. For decades, colonoscopy has been promoted as the gold standard in colon cancer prevention. Doctors order it almost reflexively once patients cross 50, and many people assume that if screening is good at 50, it must be even more important at 70. But the truth is far more complicated, and for many older adults, potentially dangerous. Once you pass 70, and especially after 75, the balance between benefit and risk shifts dramatically. While colonoscopies can indeed detect and remove precancerous polyps, the procedure itself carries risks that grow with age, and the benefits become smaller than most people realize. Let's start with the preparation. Anyone who's had a colonoscopy remembers the harsh laxatives required to clean out the colon. For younger adults, it's unpleasant but manageable. For seniors, though, that prep can be hazardous. Strong laxatives often lead to dehydration, dizziness, or even kidney stress conditions that are already more common and more dangerous after 70. Some patients end up hospitalized before the test even begins. Then comes sedation. The medications used to put you in twilight sleep can trigger confusion, delirium, or even longer-term cognitive decline in older adults. Families sometimes report that their loved one wasn't the same for weeks after anesthesia. For someone who already has mild memory issues, sedation may worsen them, and the procedure itself is not risk-free. While doctors describe colonoscopy as routine, it carries the risk of bleeding, tearing, perforation of the bowel, or heart rhythm problems triggered by sedation. These complications may be rare overall, but they're far more common and serious in seniors. The numbers speak for themselves. A massive 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. The results were sobering. For every 1,000 colonoscopies, only 2 lives were saved by catching dangerous cancers. But more than 20 patients experienced serious complications, including bleeding, perforation, and hospitalizations. That's a 1:1 risk-to-benefit ratio. For older adults without symptoms, no bleeding, no family history, no worrisome changes, routine colonoscopy simply isn't worth it. Consider the case of Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She felt fine, no abdominal pain, no blood in her stool, no history of colon issues. But her new primary care doctor urged her to get a routine colonoscopy, insisting it was necessary. Dana reluctantly agreed. During the procedure, doctors found and removed a tiny polyp. It seemed like no big deal until that evening when Dana doubled over in pain and fainted. At the hospital, scans revealed a perforated bowel, a serious complication directly caused by the procedure. She spent 9 days in recovery, lost 10 pounds, and never regained her full energy. In hindsight, the colonoscopy had been unnecessary. She'd already had 2 clean scopes earlier in life, and her risk was low. This is why the U.S. Preventive Services Task Force now recommends stopping routine colonoscopy screening at age 75 for most people. After that, the risks outweigh the potential benefits. For healthy seniors who want ongoing monitoring, safer alternatives exist like the FIT test, a simple stool-based test done at home. It requires no prep, no sedation, and still catches most significant cancers. The takeaway is simple colonoscopy can be life-saving for middle-aged adults, but after 70 and especially past 75, it can easily do more harm than good. If your doctor suggests one, ask, do I have symptoms that truly require this? Do safer alternatives exist? Sometimes the bravest, smartest choice is not another invasive test, but knowing when to stop. It sounds like the ultimate safety net, a full-body CT scan once a year to catch cancer early and give you peace of mind. Clinics market it as the smartest way to stay one step ahead of disease. Wealthy executives even pay thousands of dollars for it as part of elite health packages. But here's the reality for seniors, especially those over 70. Annual full-body CT scans can do far more harm than good. The reason comes down to radiation. A single CT scan delivers a massive dose of ionizing radiation between 10 and 20 millisieverts. That's the equivalent of about 500 chest X-rays in one sitting. Radiation isn't just an abstract risk. It damages DNA and raises cancer risk. According to a 2023 JAMA Internal medicine. Modeling study, the rising use of CT scans in the United States may now be responsible for up to 5% of all cancers nationwide. To put that in perspective, that's the same cancer burden linked to drinking alcohol every single day. And the risks don't stop there. CT scans are so detailed that they almost always uncover something: tiny nodules, harmless cysts, calcifications, or scar tissue that mean nothing for your health. But once they're spotted, they set off what doctors call the red flag effect. The report says abnormal, the doctor feels pressured to investigate, and suddenly you're on a conveyor belt of extra scans, biopsies, or even surgery. All for something that never needed treatment. Consider the story of Marcus, an active 80-year-old who had taught martial arts well into his senior years. He felt fantastic, fit, sharp, and energetic. But during a premium health checkup at a private clinic, his package included a full-body CT scan. The scan revealed a tiny 3mm nodule in his lung, something so small and common that most doctors would ignore it. Instead, the finding triggered alarm. Marcus was referred to an oncologist who ordered a PET scan just to be safe. That scan suggested further investigation, so a needle biopsy was performed. The result, completely benign. But the procedure punctured his lung, causing it to collapse, a complication called pneumothorax. Marcus was hospitalized for 2 weeks, then spent nearly 2 months recovering. He had gone from perfectly healthy to fragile and anxious, all because of a scan he never needed. Marcus's story is not unique. Experts in radiology and preventive medicine now emphasize that full-body CT scans should never be used as routine screening in people without symptoms. The American College of Radiology is unequivocal. There is no proven survival benefit from scanning the whole body in asymptomatic adults, but there is a very real risk of harm. So, when does a CT scan make sense? Only when there are clear warning signs. If you're coughing up blood, losing unexplained weight, experiencing severe abdominal pain, or showing other concerning symptoms, a targeted CT scan of the specific area can be life-saving. But scanning your entire body just in case is like sweeping for treasure with a landmine detector. You might find something harmless, but the damage caused along the way could be devastating. The smarter, safer approach is to focus on listening to your body and sticking with regular symptom-based checkups. Routine blood work, blood pressure checks, and physical exams catch most issues without exposing you to unnecessary radiation. When additional imaging is needed, ask your doctor, what exactly are we looking for? Will the results change my treatment? If the answer isn't clear, it may not be worth the risk. Annual full-body CT scans promise peace of mind, but in reality, they often deliver fear-invasive procedures and sometimes lasting harm. Prevention isn't about blasting your body with radiation every year. It's about maintaining healthy habits, paying attention to changes, and choosing medical tests that actually improve outcomes. The bottom line, if you feel well and have no troubling symptoms, resist the temptation of full-body scans. Trust evidence, not marketing. Your health is better protected by smart choices than by machines that see too much and tell you too little. So, what have we learned? 5 of the most common medical checkups given to adults over 70, the bone density scan, brain MRI for memory loss, cardiac stress test, colonoscopy, and the annual full-body CT scan can sometimes do more harm than good. What's presented as routine prevention can in reality open the door to unnecessary treatments, frightening diagnoses, and complications that rob seniors of health and independence rather than protect it. Modern medicine is powerful, but it isn't perfect. Technology can save lives, but it can also create problems when used without caution. That's why after 70, the wisest approach is often the simplest. Sometimes less really is more. Before agreeing to any test, pause and ask one critical question. What happens next if this test shows something abnormal? If the answer is unclear, if it leads only to more scans and more uncertainty, it may be time to reconsider. Because real prevention doesn't start in a scanner or in a lab, it starts in your daily life. Staying active, eating nutrient-rich foods, getting restorative sleep, and maintaining social connections are all proven to reduce disease risk and extend healthy years. These are the foundations of lasting wellness that no machine can replace. So as you move forward, remember your health isn't measured by the number of tests you take, but by the choices you make every day. Choose wisely, Live fully, and let medicine serve you without letting it overrun your life.